Hello and welcome to It's Personal, brought to you by Gundersen Health System. Coming up, you'll learn about the new Legacy building, which is scheduled to open in January of 2014. One of the new elements is emergency services. You'll find out how patients will be cared for in this new space. Also, the community has responded to the Legacy building in a unique way. Find out how community involvement will be making a big difference for patients for generations to come. And later, green technology is a large component of the new Legacy building. You'll hear how it will save energy and money. That's all next on It's Personal, brought to you by Gundersen Health System.
Between kids, the dog, working, and housework, it's hard to know where it all ends sometimes. But when it comes to your family's health, Gundersen Health System is where it begins. We understand you lead a busy life. That's why we provide most of the care your family will ever need, right nearby. From annual exams and broken bones to treating illnesses and chronic conditions, Gundersen is where health begins for your whole family. Need a primary care provider? Visit gundersenhealth.org/families.
Welcome back to It's Personal. I'm Chris Stauffer. Gundersen Health System is a Level 2 trauma and emergency center, and that means our region relies on Gundersen's doctors, nurses, and support staff to be able to treat some of the most critical patients around. And Gundersen is getting some new space to be able to do that. Stephanie Hill is the clinical manager of emergency services at Gundersen Health System. And Stephanie joins us now to talk a little bit more about what emergency services are now going to be able to offer in this new enhanced space. And I guess maybe that's where we should start, is to say, you know, you've been taking great care of patients in a limited space and now some expanded space. What does that allow doctors, nurses, support staff to be able to do in emergency services?
Well, I think we do a great job caring for our patients now, but it feels so tight and so chaotic in that small space, and there's not great privacy for our patients. I think the whole feeling will be so much different. Right now, when patients are in the emergency room, they know there's dozens of patients in there because they can see them and hear them around them. Now, it will be so calm and quiet, and all the rooms are private, and patients can just focus on getting better, and they and their families can have privacy.
Privacy is a big reason for the Legacy building, I know, and I think sometimes people are surprised to learn that some of our most critical trauma patients were sometimes sharing a trauma room. Can you talk about that?
Correct.
And how that's going to change?
Yes. Currently, we just have 2 big trauma rooms. We could turn 4 rooms into trauma rooms, but it wasn't ideal. In the new space, we'll have 5 large critical care rooms that they can care for our most sick patients and all of our trauma patients. And they're all private, and they're divided by walls and glass doors, not by curtains as we currently have. In 2 of our rooms, you can open the glass doors, and we would only do that for 1 patient if it was a particularly severe incident and we had a large team caring for that patient.
And that sounds like that's part of the issue, is that there's so much more equipment these days, and the teams are larger to take care of some of these, some of the more critical patients.
Yeah, for example, if we have a chest pain or MI patient or a stroke patient or a trauma patient, it's not just our emergency services team, but it's also our specialists, our general trauma team, our cardiologists, our stroke neurologists. So we can have an upwards to 8-10 people caring for 1 patient, and we need room for the whole team.
And the equipment that goes in there. And I know that there's been some really some creative ways of putting some of that equipment up off the floor. Can you talk about that?
Yes, we have beautiful trump booms and lights in our new rooms. So these are all hang from overhead and are controlled easily, but most of all of our equipment can be on them. All of our suction and IVs and medical gases are all off of that one central boom. So there's a lot more space on the floor for our team members.
I know a lot of thought has been put into these new rooms, and even right down to the lighting itself. Can you talk a little bit about the lighting?
Yes, we do have awesome state-of-the-art lighting. Actually, the lighting in the critical care rooms is the same type of lighting that's in the operating room, so that's how specific it is. So it's all LED lighting and it's laser-based, so it can really focus in if we're looking at a small area.
And one of the things that I've learned is that it's energy efficient too.
Correct, as well.
Yeah. Some of the other rooms, if there are patients that are not what we'll call critical, but they're still coming into emergency services, there are some smaller rooms. Can you talk about how those patients are then going to be taken care of if they're not critical?
Sure. We have, the majority of our rooms are just all general treatment rooms, so we can take care of a wide range of anything and everything that comes in. And what's great are all of these rooms are virtually identical. All of the equipment is in there, they're all set up mainly the same way, so that will allow for great fluency with our team members and a lot of flexibility for rooming all of our patients. We have a couple of specialty rooms for patients with eye injuries or nasal ENT injuries, we call them, but even these rooms have that specialized eye or ENT equipment, but they have all of our general equipment too, so we can use them just for a regular patient as well.
Many hospitals have a combined urgent care and trauma unit, and it's something that Gundersen has had for a while now, I think 3 years, something to that effect, but they have been physically separated. Now those two units will be merged. Can you talk about why that's important?
Correct. Truly, we will be one emergency services in the new Legacy building. You present to emergency services for your mild ailment, your sore throat, or for your emergent chest pain. You come in that same entrance, you're triaged by the same triage nurse, and she or he essentially sorts you, and we get you to the right level of care and can take care of everything in emergency services.
We're talking with Stephanie Hill, Emergency Services at Gundersen Health System, about the new emergency services in the Legacy building. One of the other aspects that a lot of people I don't know necessarily think about is the behavioral health patient that comes in through emergency services. And that aspect has really been very well thought out too in the new Legacy building.
Behavioral health patients do account for nearly 20% of our population in emergency services, and that's a typical percentage for all emergency services throughout the United States. So we do have to consider this population because it's one of our most common patient types. These patients come in and they're very fragile, and in our new space we have a separate behavioral health core or zone where there's 3 rooms in a separate area. So these patients can be kept safe and private without being exposed to the other chaos within the department.
Yeah, excellent point. Another aspect that a lot of people don't think about is the families that are coming in a critical care situation or an emergency situation, but there's been a lot of thought put into some of the waiting areas for the families. Can you talk about that?
Yes, we have several different waiting areas and then several different private consultation and family rooms as well. Today, we basically have one waiting room. So whether you're waiting to be seen for your upset stomach or you're the wife of a critically ill man, you're all in the same waiting room, and that just isn't ideal. So now we have the waiting room for patients waiting to be seen, and then we also have a separate one for family members, and we have several private family and consultation rooms back within the department if a family has something serious going on.
One of the cool things, and I'll use the word cool, is the new ambulance bay. Talk about the ambulance bay and how that's going to make a difference for people coming in that way.
We are so excited to have a drive-through ambulance bay. It's completely enclosed, so we don't have to unload our patients and deal with the elements. We can come drive right into a temperature controlled. It has snow melt grating on the bottom floor. They can just roll right into the emergency department. We can fit 4 ambulances in there at a time.
And it doesn't matter if it's hot or cold or whatever, they're in a protected area too from the elements. I know that from having talked with you about this previously, there is also another use for that ambulance bay should the situation arise.
Correct. Our whole ambulance bay is a huge decontamination unit, which can be used. Basically, it'll be the decon unit for the whole tri-state area, really. Nobody else has anything this big. So we have our separate little decon room that we can use for a small exposure for a patient. But if there was a large chemical explosion or spill, and all of our ambulances and equipment and personnel and multiple patients were all exposed to something that we had to decon before we brought them into the emergency room, we can seal off that whole ambulance bay, and it's all has showers, and we can decon that whole unit in there.
Another thing that a lot of people just don't think of, and we hope that it's something that we never have to utilize, but it's nice to have it there in the event of a situation where there's a chemical spill or explosion or that kind of thing. And in the past, from what I understand, there had to be tents set up, and it was kind of based out of a small closet in the old hospital.
We had a real small closet in our current space, and then if we needed to do something on a larger scale, we had to go out and get a trailer which had a tent in it, and we would set up that tent and we would do it outside, which isn't ideal in Wisconsin, obviously.
No, that's for sure. Stephanie Hill, thanks for joining us. We appreciate your time, and good luck in the new Legacy building.
Thank you.
Before Gundersen Health System opens doors to the Legacy building for patients, the doors will be open to the community. The open house is scheduled for Saturday, January 11th and Sunday, January 12th. Of course, that's 2014, from 10 to 5 on both days. Guided tours of the Legacy building, hands-on exhibits, Teddy Bear Hospital for the kids from 10 until 2. And again, those tours will be offered continuously. For more information about the open house, go to the Gundersen Health System website, gundersenhealth.org. Next, the community has responded to the Legacy building in a unique way. We'll explain. I'm Chris Stoffer for It's Personal, brought to you by Gundersen Health System.
Are you confused by all the talk about the healthcare marketplace and insurance exchanges? There's just one thing you need to remember. Gundersen One. It's a new option from Gundersen Health Plan, which is locally owned and operated. If you need to purchase health insurance for yourself or your family, Gundersen One offers a choice of plans to fit your budget. To learn more or to enroll, visit gundersen1.org or call the Gundersen Health Plan Enrollment Center at 608-775-8092. That's 608-775-8092.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Chris Stoffer. Before Gundersen Health System opens doors to the Legacy building for patients, the doors will be open to the community. You can get a first look at how Gundersen Health System is creating a healing environment that will allow for greater patient privacy, improved efficiencies, and one that will allow doctors, nurses, and staff to provide exceptional care for you, your family, and the community for years to come. And a reminder that the open house is Saturday, January 11th and Sunday, January 12th, 2014, from 10 to 5 on both days. Tours of the Legacy building, hands-on exhibits. There will be a Teddy Bear Hospital for the kids. That's running from 10 until 2. Gundersen Health System is opening the Legacy building, and community support for the building has been an integral part. Joining us today to chat about the community involvement is Phil Schumacher from the Gundersen Medical Foundation. And Phil, I think that's one of the things that we have to talk about. More than 4,000 people in our community have donated to the Legacy building, the campus renewal campaign. That's amazing.
It is amazing, Chris. And it's something that we weren't surprised about because we've had campaigns in the past and the community has always stepped up to help Gundersen.
And that building that is coming up is going to be something that will be used for generations to come.
The Legacy building was created to be here for at least 50 years, and it was built with that kind of perspective in mind.
I know that there's been a number of people that are going through the building for tours. What are some of the things that some of the major donors are saying to you on those tours?
Well, you know, Chris, the fun thing is that most of these donors that have made their gifts, before we asked them for gifts, we took them into the old building and we showed them what the operating suites were like. We showed them what double patient rooms were like. And to see the looks in their face now when they are in that building and the joy that they're getting from having made a gift is really significant, and it's a lot of fun.
Now, I know that there's a number of different people who have made some significant gifts, and a couple of the areas that I think are going to maybe stand out because they're in more public areas, shall we say. One of those areas is the indoor healing garden. What can you tell us about that?
Well, the indoor healing garden is a beautiful space that has both real and artificial plants. It's a quiet setting right in the heart of the lobby with beautiful skylights, lots of areas for people to just look in if they want, or to go in and actually sit among the foliage and with a waterfall in the background. That gift came from Marjorie Collins and her late husband Charles. And I think Mrs. Collins, who really saw this as a need for the community to have a hospital of this caliber, it gives her great joy to see the space and to know that within that space is something that honors the legacy that she and her husband Charles have for this community and for Gundersen.
One of the things I think that you have to be proud of is that there are a number of people who work at Gundersen who have donated to the campus renewal campaign. And I know Dr. Todd Marr, who is known nationally for the work that he's done as a pediatric allergist, he made a major donation too.
The Marrs found a beautiful opportunity. They underwrote the cost of our beautiful fountain feature as you come into the circle in front of the building, and they did it to honor their daughter Caitlin, who died.
Doctors, administrators, support staff, nurses, technicians, all supporting the campus renewal.
We have more than 2,000 of our employees, including physicians, who have supported this. The physicians, as you would expect, stepped up in record numbers, but to a level that we were hopeful but weren't sure they could do, and they've gifted almost $7 million to date.
And a total of about $45 million, from what I understand, has been donated to the campus.
We are already over $45 million and are looking to do more.
Got to be one of the largest projects in La Crosse.
As far as I know, it's the largest project in the region, yes.
What's next? What is next on how people can be a part of the campus renewal campaign? Because I know that philanthropy can still make a difference in the building.
What comes next is the opportunity, one, for people to continue as they see this building to say, I want to be a part of it. We have naming recognition that remains there. Just in terms of general recognition, anyone who makes another gift or a first-time gift will also be recognized in the lobby of the building in our donor recognition area. And then I think as people see what this hospital can do and what it means to the community, if they have ideas, that would be very helpful.
One other thing that's recently come up is the Glendenning gift. Can you talk a little bit more about that, Phil?
Yes. Jack and Rosie Glendenning and their family came to us with an interest in helping us with our interventional neurological center. And Rosie, unfortunately, some years ago had a couple of strokes. She is a very functioning wife and mother, but they wanted to do something for the community so that others would not have to go through what maybe they did. And with a very generous gift, they provided to put Rosie's name on that center. And I know that Jack and Rosie are thrilled, and it is truly a state-of-the-art center of excellence for Gundersen.
It's going to be helping people from Wisconsin, Minnesota, and Iowa at the same time. Another group that we certainly want to recognize is really a family, and that's the Barb and Dave Scogan family. And they've not only been generous donors, they've also been key in helping to establish a system of getting donations in, and they've been co-chairs from what I understand.
Right. Dave and Barb decided that they wanted to do something further than just make a gift, and they agreed to co-chair our community campaign. And as a result of that, we have more than 14 gifts of $1 million or more, much of it due to the influence and the work of the Scogans. They have been champions for us in this campaign. They've been at multiple events, and they're very excited about the building, as we all are.
And a lot of people, I'm sure, recognize the boomerang theory that they have at Festival Foods, and that's going to be find its way into the clinic lobby, from what I understand.
It is. This was actually the idea of one of our workers who came up with the concept, and we only just recently told the Scogans about it, so they were quite surprised, and it was a way of recognizing their leadership.
The Children's Miracle Network Hospitals has been something that has been part of Gundersen Health System for many, many years. And the Children's Miracle Network Hospitals is also going to be a part of the Legacy Building. Can you talk a little bit about that?
Yeah. Very early in the campaign, we went to Children's Miracle Network and asked them for a significant contribution. We gave them the concept of providing service across an entire floor of both the clinic and the hospital. So when you see the new hospital open and you see the amazing pediatric floor, you'll realize that this comes from the efforts of Children's Miracle Network, which has committed $5 million towards the construction of this beautiful space.
We're talking with Phil Schumacher from the Gundersen Medical Foundation, a little bit about what it takes to, I guess you could say, raise a building, the Legacy building, and of course the grand opening is certainly happening very soon in the month of January, and we'll have more details on that in just a little bit. But what the Legacy building allows for doctors and nurses and support staff to do for patients in the region is really the reason that you're out asking for that help, that assistance from the community. And it's got to be a good feeling to know that this is all coming to light now.
You know, when we started talking with doctors and staff members about the building, and we saw what they were working at the time and still achieving significant numbers that were nationally ranked us among the very best hospitals in the country. But we saw the challenges they faced with continuing to deliver that level of care. So the building provides them with a new platform for care. But in addition, Chris, it also provides us with an opportunity to recruit and retain these outstanding doctors that want to work at a place like Gundersen.
Phil, we're just about out of time, but one of the things that I know that you've talked about too is how businesses in our community have been impacted just by the construction over the last 3 years of the Legacy building.
90% of the contracts that could be handled by companies locally were handled by companies locally. And throughout this 3-year building process, we've had more than 350 local workers on site in that building. And it is, I think they took great pride in the fact that they were building the hospital that was going to be looking after their family. And I think they were also thinking that this is something that I can turn to my children or grandchildren and say, I helped build that building.
And again, to provide that exceptional level of care to patients closer to home for generations
to come.
All right.
Okay.
Phil Schumacher, thanks for your time. And remember, the Community Open House for the Legacy Building is scheduled for Saturday, January 11th and Sunday, January 12th from 10 until 5. Coming up next, the green elements of the new Legacy Building are second to none. You'll learn more in a moment. I'm Chris Stauffer for It's Personal, brought to you by Gundersen Health System.
Wow, what a great game. But that meatball sub, it sure gave me heartburn.
You're sweating and breathing kind of hard. Are you sure you're okay?
So I got a little worked up over that last play. What are you, a doctor or something?
No, but I read that chest pain from a heart attack can be mistaken for heartburn. Does it hurt anywhere else?
My arm aches some, but armchair quarterbacking is a tough job.
That's it. You're going to the ER.
Is it heartburn or a heart attack? Gundersen Health System urges you to learn the difference. It could save a life. Go to gundersenhealth.org/chest-pain.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. Before Gundersen Health System opens doors to the Legacy Building for patients, the doors will be open to the community. And on Saturdays, January 11th and Sunday, January 12th, you'll be able to get a first-hand look at how some of the green elements are incorporated into the building. Joining us now is Alan Eber. He's a manager in facility operations to tell us more about those green aspects. So Alan, I guess the first question has to be, this building is green. Talk about that a little bit. What does that mean?
Well, for starters, this building is LEED certified. That's what we're going for, and we're in very good shape to get LEED certification for this building. Part of being LEED certified, you need to be energy efficient, and you also need to construct your building and build your building using environmentally friendly practices. Some of those things are we are using recycled material as much as we possibly can throughout the building. Also in the construction itself, we are achieving a 93% recycling rate out of all the material that we had to demo from the site, which is a very high level.
Can you give me an example of that? Because when you talk about recycling construction material, I don't know that a lot of people really understand that. Can you give us an example of what that means?
Well, there's always scrap when you build a building. There's excess material that you need to get rid of that doesn't go into the building. That material itself gets recycled. You know, the wood that we use to build the building gets recycled. a lot of steel that all gets recycled. And this building was built attached to an existing building, so there was a lot of demolition that needed to take place. And when we demoed the old building, a lot of that material was recycled as well instead of going into the landfills.
One of the things that I think a lot of people are going to, hear about is the fact that there's a biomass boiler and there's geothermal heat that's used just to keep the building hot and cold. Can you talk a little bit about, sort of how the building operates, if you will?
Yeah, we challenged our architects and engineers to a very high level of efficiency in this building. In fact, our goal is to be in the top 1% of all hospitals in our region. And one of the items that they really came up with is a geothermal heat pump. And what we're doing is we're using the mild temperatures that are underneath the earth, and we're using that to both heat and cool our building. So we're taking the energy when we need the energy from the earth and putting it into our building. And when we're trying to get rid of energy, we put that back into the earth. And it's a very efficient way to both heat and cool your building.
That temperature in the earth, not too far below the surface, as you said, is pretty steady. What is it, like 60 degrees or 50 degrees or something?
We've been seeing about 53 degrees is what we have down there.
Yeah, and that constant temperature then helps. I certainly understand that. Talk a little bit, though, about the biomass boiler, because that's gotten some attention in the media, but I don't know that everybody really understands what a biomass boiler is.
To heat this building, we also use steam. And to make steam, typically what people do is they burn natural gas, which is a fossil fuel. We just installed, at the beginning of this year, a biomass boiler. So instead of using natural gas, we use wood. And we get that wood from local sources around the area. We have a number of different suppliers that provide us with all the wood that we need to supply steam to this hospital.
Talk a little bit about that wood product, because I know some people are saying, hey, I got a tree in the backyard that's been dead for years. I'd love to bring it on over and help heat the hospital, but it doesn't really work that way.
Yeah, no, we're very specific about the wood that we burn here at Gundersen. We only burn wood that has no glues, has not been treated in any way, there's no paint on it. And as we found out over the last year, it takes a very particular type of wood to go into this boiler to minimize our labor costs associated with this. So we have suppliers. They're all mill suppliers. So these people make rough cut lumber, and then what they can't make into rough cut lumber, they chip up, and we get their byproducts.
We're talking with Alan Eber. He's really kind of in charge of all the green that's going on inside the new legacy building at Gundersen Health System, which is set to open up in January, and we'll have some details on that in just a moment. But Alan, what else is inside the building to make it more energy efficient? I know there's a lot of glass that's in the building, and I'm sure that there's been a lot of talk about how to make this building as energy efficient as possible.
Yeah, one of the other large things that we did on this building is we really, the shell of the building itself is very efficient. We exceeded the insulation requirements of today's building by, in some cases, 35%. But the other thing that when we designed this, we also wanted it to be a pretty building. So there's a lot of glass. When you come into this building, you'll see a lot of glass on the building. There's two things about glass for energy. In the summertime, when the sun shines through, you can get a lot of, they call it solar gain, or you get a lot of heat transferred from the sun into the building. This glass has a film on it that reduces the amount of solar gain that you can get inside the building, so that we don't have to remove that heat from the building. In the wintertime, you get a lot of heat that transfers out of the building. So this glass also has a lot of features in it that we minimize the amount of heat lost through the glass itself.
Amazing technology,
it really is, yes.
One of the other cool parts of the building is that there's a lot of local contractors that are working on the building, but lots of local sources used in materials as well.
Yeah, that's true. That was one of the big things that Gundersen wanted to do in this building, is really try to keep it as local as we possibly could, because it will be serving our community. You talked about the contractors. We had a very high contractor rate from this area. In addition, a lot of the materials that are going into this building were sourced locally. A perfect example is the stone that you see on the building. All that stone in a number of different areas throughout the building was all made in New Ulm, Minnesota. So that's local material. And getting back to the biomass boiler, instead of buying this natural gas from another region or another country even, we're buying our wood right here from the local areas and supporting our local economy by doing that. So we really have taken a lot of steps to try to keep this building and what we're doing in it local.
All right, Alan Eber, thanks for joining us, and look forward to opening up the new building and hearing you talk a little bit more on some of those tours about what's going inside the building and all the green aspects involved in it. And good luck with that LEED certification as well.
Yes, thank you, Chris.
All right. Thanks again, Alan. And again, the open house is Saturday, January 11th and Sunday, January 12th, 2014 from 10 until 5, both days. You can get more information on the open house by going to the Gundersen Health System website, gundersenhealth.org. And that wraps it up for this edition of It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. Thanks for joining us.